Hi, my name is Elizabeth Shaid, and I'm a nurse practitioner in Philadelphia. Incontinence should not be thought of as a normal part of aging. There are some changes that normally take place in our bladder and our urinary tract as part of aging, and there are two that we typically think of, which may contribute to a problem with incontinence, but should never be considered a normal part of the aging process. In the first part, there is an increase in the post-void residual urine. That is the volume of urine that's left in the bladder after someone urinates. And having an increased post-void residual leaves less room for additional urine to continue to fill before someone would have the urge to urinate another time. As you can imagine, if somebody doesn't have a lot of room left, they're going to need to go to the bathroom more often. And having an increased post-void residual urine also sets someone up for the increased risk of developing urinary tract infections. In addition, older people generally have more urine production when they're at rest, because when you're at rest, it allows your body, your heart especially, to be able to pump fluids that are caught in your extremities back to be processed by your kidneys for elimination. And that may cause you to need to urinate more at rest, which often means that an older person who when they were younger may have not needed to get up at all to urinate overnight, or maybe once at night, now may need to get up 2 or 3 times overnight to urinate as a normal part of the aging process. What I hear from many patients is that they plan their whole day around how well they'll be able to empty their bladder. I don't have a urinary incontinence issue, but I know that if I'm seeing patients in their homes, I'm going to plan my day around where I can find a clean bathroom. In Philadelphia, we have these great little convenience stores called Wawa that have remarkably clean bathrooms. And I literally schedule my patient visits around where I know that there is a Wawa that can provide me with a clean bathroom. But I hear from patients that they limit their social interactions so that they know exactly where bathrooms are. Maybe they won't go to a shopping mall if they think they won't be able to get to a bathroom as frequently. Or maybe they'll not schedule a lunch date. And this can lead to social isolation and to increased amounts of depression. And that's why incontinence for a long time was known as a closet health issue, because people didn't want to talk about it. They didn't seek treatment for it. But again, I congratulate you for taking this step to get treatment for your incontinence problem with all of the different techniques that we're going to talk about, but most importantly with the Zida sock.